All right, dear colleagues and ladies and gentlemen, I'm Dr. Takahiro Kanno from the International Exchange Office, Faculty of Medicine, Shimane University. Welcome to SDGs Seminar Symposium. 世界の医療と SDGs を知ろう、インド編ということで、今日は、SDGs の、セミナーに、大変多くの皆様ご参加くださいまして誠にありがとうございます。私は、島根大学医学部国際交流推進室の菅野でございます。今日は、6時から7時まで、でございますけれども、レクチャーとその後のディスカッションができましたらというふうに考えております。The United Nations Sustainable Development Goals, SDGs, 17 goals with 169 targets that all 191 UN member states, so nearly 200 countries, agreed to try to achieve by the year 2030. So we have eight more years left. Health has a central place, as you know, in SDGs goal number 3. Ensure healthy lives and promoting well-being for all at all ages, underpinned by 13 targets that cover a wide spectrum of, especially WHO's work. We are all healthcare providers today, faculty members or residents, consultants, junior residents, and even students. Today, more than 100 healthcare providers or future healthcare providers got together. So I would like to introduce today's lecturer, Professor Krishna Kumar Raja. We call him KK Raja. He is the chair professor of the Department of Maxillofacial Surgery in SRM University in Chennai, India. I'm very greatly honored to introduce Professor KK Raja. KK Raja, can you please share your slide, or can you please open up your screen?
Yes. Hiro, I am, it says host disabled participant screen sharing. Can you enable me to share my screen, please?
Okay. So he is kindly with us today in Izumo, and
yeah. So
can you share the screen? Okay.
It says host disabled participant screen sharing. I am not able to share my screen. Can someone help me, please?
Okay. I'll ask Dr. Okui.
Okay. Yeah, please.
Okay, Sensei, can you please share the screen?
Yeah, I am not able to share. It says host disabled participant screen sharing. So
wait a moment, please.
Yeah.
He has to make you the host.
Yeah, if you can make me the host, I'll be able to share the screen.
Okay.
So it says,
Once again.
Excuse me, everyone. Today, more than 100 participants registered, and half joining from Japan, and the other from India. The other participants are from India. Welcome to the SDGs session from India, and it will be a wonderful time to share the importance of SDGs. All right, good. So you may begin your presentation, Professor KK Raja.
Yes. I will do in a minute.
Okay, thank you very much.
Can you see?
Yes, I can see your screen. Thank you very much.
Okay. So good evening, one and all present here, and also to those who have registered on Zoom to attend this lecture. At the outset, I wish to sincerely thank Professor Kano and Shimani University Faculty of Medicine for giving me this great opportunity, and also for this collaborative project between our two universities. I've been in Japan for the past 1 week. I am extremely happy to be here. I'm enjoying my stay in Japan, and especially the hospitality of the lovely people of Japan. So before I start my lecture, I would like to say a few words about the university from where I come, the university where I teach, and I head the Department of Maxillofacial Surgery. The university is called SRM University. It is based in Chennai. Chennai is a city in South India, one of the 4 metropolitan cities of India. And this university based in Chennai is one of the top ranking universities in India, with over 20,000 students and more than 2,600 faculty across all its campuses. It offers a wide range of undergraduate, postgraduate, and doctoral programs in engineering, management, medicine, dental, and allied health sciences. SRM has a very strong research department which carries out cutting-edge research in frontier areas with more than 224 government-funded projects as of now. The university is, SRM is known for its well-designed campus, which is spread over an area of 250 acres. And this is the dental college where I teach. The dental college is a separate building with all the specialties of dentistry. We have the undergraduate and postgraduate outpatient department of maxillofacial surgery in the ground floor of this department. And we, as a dental college, SRM Dental College, are among the top ranked dental colleges in the country. We, as of last year, this year, we are ranked 8th in the country. We have an intake of about 100 undergraduate students and 54 postgraduate students, out of which the Department of Oral and Maxillofacial Surgery has an intake of about 8 postgraduate students per year. We also have our own hospital, general hospital, which is exclusively meant for our maxillofacial department. Of course, in addition to our maxillofacial department, we also have other specialties here, like the other specialties of medicines like plastic, ENT, orthopedic, gynecology, general medicine, general surgery, etc. So this is a very nice state-of-the-art hospital where we do all our maxillofacial procedures. So I am Professor V.P. Krishna Kumar Raja. Thanks, Professor Kanu, for the kind introduction. I head the Department of Oral and Maxillofacial Surgery. And I was asked to give this lecture on SDGs, which is the short form for Sustainable Development Goals. Now, SDGs emphasize the interconnected environmental, social, and economic aspects of sustainable development by putting sustainability at their center. So this was developed in 2015 by the United Nations. The mission statement for SDGs is a shared blueprint for peace and prosperity for people and the planet now and into the future. It is a non-profit project, and the location is a global location owned by the United Nations and by the by the world community, founded by United Nations and established since 2015. The SDGs are a collection, as Professor Kano has already mentioned, are a collection of 17 interlinked global goals designed to be a shared blueprint for peace and prosperity for people and the planet. now and into the future. So this is the aim of this project, if you may call it, is to make sure that there is peace, prosperity in all forms for the people of this planet, not only for us in the present generation, also for the future generations to come. The SDGs were set up in 2015 by the United Nations General Assembly, the UNGA, and are intended to be achieved by 2030. In short form, the SDGs is called the Agenda 2030. Actually, the United Nations had a similar kind of program which was started in 2000. It was called the Millennium Development Goals, or in short MDG. But for some reason, the goals were not achieved by 2015, and so they reinvented, and they probably thought that we should. Sorry, yeah. Can you hear me?
Yes, I can hear you well. Yeah.
Oh, sorry. Yeah. Yeah. Sukanya, please. Yeah. So one of the reasons why they say the MDGs did not succeed was probably because they were planned and developed by technocrats, which was not the proper thing to do. So now the SDGs, which has 17 SDGs, as Professor Kanu has said. These 17 SDGs, as I'm sure most of you are aware of the 17 SDGs, which includes eradication of poverty, zero hunger, good health, wellness, and all the other SDGs. But today, the scope of today's lecture is to discuss not too much in detail, but at least discuss in brief about the third goal, which is the good health and wellness goal. What India is doing from its part to achieve the goals. As you all know, since these are goals which have to be achieved by 2030, just one country achieving these goals is not sufficient. All the countries, the 193 countries which have signed up to achieve these goals, have to actively take part, so that all these goals are achieved by 2030. I was so happy to see that Japan is so actively involved in the SDGs. They probably have the 1 week that I stayed in Japan. I am of the opinion that the Japanese people have already achieved most of the goals. And these are the signs of SDGs all over Japan. That was taken while I was going to Mount Fuji on a holiday, and the second one is from a small store, a souvenir store in Kyoto. So this is very happy news that countries like Japan and advanced countries like Japan are really serious about SDGs, and I hope the rest of the world are also very serious to achieve these goals by 2030. These are the efforts, Japan's efforts to achieve these goals. These are actually pictures taken in the hotels that I stayed in the last 1 week. The first one is the hotel in Tokyo, and second one is the hotel in Kyoto. So very happy that Japan is very serious and trying to achieve these goals. So today's topic, as I said, I'm going to discuss not too much into detail because this among all the SDGs, the SDG 3 is the most extensive and very elaborate SDG. And so within that 45 minutes that I've been given, I don't think I'll be able to cover discussing SDG 3 and India's progress in SDG 3 in detail. But at least I'll be able to discuss in brief what India is trying to do and hopefully achieve these goals in the next 8 years. So SDG 3, as I already mentioned, is to ensure healthy lives and promote well-being for all at all ages. There has been worldwide significant stride made in increasing life expectancy and reducing some of the common causes of child and maternal mortality. Now, the SDG 3 aims to prevent needless suffering from preventable diseases and premature death by focusing on targets that boost the health of a country's overall population. And the priority areas being regions with the highest burden of disease and neglected population groups. So SDG there is some disturbance. I'm not able to talk. Yes, sir. So SDG 3 has 13 targets and 28 indicators to measure the progress towards these targets. Out of the 13 targets, the first 9 targets are the outcome targets, and the rest 4 targets are the means to achieve these targets. So let me enumerate the first 9 targets, otherwise the outcome targets. The first target is called a reduction of maternal mortality. There's a lot of importance given in SDG 3 towards maternal and child health and well-being. So the first is reduction of maternal mortality. Second is ending of all preventable deaths under the age of 5 years. Third is fight communicable diseases. You know, communicable diseases, we are still fighting communicable disease. The most recent one is, as all of us know, the COVID pandemic. And then the fourth target is to ensure a reduction of mortality from non-communicable diseases. When I say non-communicable diseases, I'm talking about chronic disease like diabetes, hypertension, cardiac diseases, asthma, and the like. And also to promote mental health. It's very important to promote mental health so that people live long. The fifth target is prevent and treat substance abuse to prevent use of drugs. Sixth is reduce road injuries and death. Seventh is grant universal access to sexual and reproductive care, family planning and education. Eighth is a very important target to achieve universal health coverage, especially for countries like India and a lot of these countries where universal health coverage seems to be lacking. And ninth goal is to reduce illnesses and deaths from hazardous chemicals and pollution. So among these 9 targets, India has done quite well with target 1, 2, 3, and 4. Target 5 is still, as far as India is concerned, there's still a concern about substance abuse. It's still quite a difficult problem to solve. Road traffic accidents, road injuries, and deaths are also quite prevalent in our country. And of course, the last one is hazardous chemicals and pollution. I will talk a little more in detail in the next few slides. So these are the 9 primary targets, and the 4 targets which are means to achieving these 9 targets. These are the first target is implement the WHO framework convention on tobacco control. Now, WHO framework control on tobacco control was developed by countries in response to globalization of tobacco epidemic. Government of India launched the National Tobacco Control Program in the year 2007-2008. And the aim of this program is to create awareness about harmful effects of tobacco consumption, reduce the production and supply of tobacco products, ensure effective implementation of, there was an act in 2003 called COPTA, which is the short form for Cigarettes and Other Tobacco Products Prohibition Act, and then help people quit tobacco use, facilitate implementation of strategies for prevention and control tobacco advocated by WHO Framework Convention of Tobacco Control. This particular means of achieving SDG 3 has been quite well managed by India. I will discuss a little more in detail in next after a couple of slides. The second means to achieve SDG 3 targets is to support research, development, and universal access to affordable vaccines and medicines. As we all know, vaccines are the most inexpensive means of improving health and lowering morbidity and mortality caused by infectious diseases in the developing world. The eradication of smallpox and the imminent demise of polio are clear reminders of the power of vaccination in dealing with the scourge of communicable diseases in the developing world. And the World Health Organization expanded program for immunization, which is otherwise called EPI, is focused on 6 major diseases of childhood, which include diphtheria, pertussis, tetanus, polio, measles, and tuberculosis. And the EPI has had great success in almost all the countries in the world. More recently is the vaccine for COVID infection. And I am also proud to say that India has one of the largest facilities to manufacture vaccines in the world. And in fact, we were one of the few countries which even exported vaccines, COVID vaccines, to other countries which needed them badly during the pandemic. And so, in India, during the period, for example, 2019 and April 2019 to March 2020, 91% of children in India in the age group of 9 to 11 months were fully immunized. When I say fully immunized, they got at least 1 dose of BCG, 3 doses of diphtheria and oral poliovirus, and 1 dose of measles vaccine. So as far as the support, research, development, universal access to affordable vaccines is concerned, India has done extremely well. The third means to achieve the targets is, this is a very, very, very important means, increase health finance and support health workforce in developing countries. Healthcare financing deals with the generation, allocation, and use of financial resources in the health system. Globally, it has been increasingly recognized as an area of major policy relevance to achieving universal health coverage. With regard to India, all Indian citizens can get free outpatient and inpatient care at government facilities. But because of severe shortage of staff and supplies at government facilities, many households seek care from private providers and pay out of the pocket. But this is not possible for people from very low income group. So recently, the government of India has launched a program called the National Health Protection Scheme. In short, it's called Ayushman Bharat, which allows them to get cashless secondary and tertiary care at a private facility. There are also a handful of health insurance arrangements for specific population groups like government employees and factory workers. Of late, the public-private partnership has been touted as a solution for the ills of the Indian healthcare system, and that public-private partnership seems to be working very well in our country. The fourth one is also very important, improve the early warning system, so global health risks. According to the World Health Organization, early warning systems are timely surveillance systems that collect information on epidemic-prone diseases in order to trigger prompt public health interventions. So I think this system failed during our COVID, and has led to an epidemic becoming a pandemic. In India, the Ministry of Earth Sciences is developing a unique early health warning system, which is expected to forecast the possibility of disease outbreaks in the country. So these are the four means to achieving the 9 SDG targets. And if you ask me how India is doing quite well with these means. Now, let me discuss in brief about each of those 9 targets. The first target is maternal mortality. The aim by 2030 is to reduce the maternal mortality ratio to less than 70 per 100,000 live births. In India, the maternal mortality ratio stands at 113 per 100,000 live births. But I would like to, I'll also, in the end of this program, I'll show you a slide to state that India, this is a figure for the whole country, but India, as some of you might know, and for those who do not know, India is a huge country. We have about 21 states and 9 union territories. So this is a general figure for the whole country, but if you look at some of these states in South India, especially from states like where I come from, Tamil Nadu, and there's also a state called Kerala, the maternal mortality rate is actually anywhere between 35 to 40. So, and it has already achieved the ratio that that is aimed by the SDG. Now, what are the government of India's various programs that will help to reduce the maternal mortality rate? The first one, the most important one, is called SUMAIP. In short, it is called Surakshit Matrivta Ashwasan. Now, before I tell you how these programs will help reduce the mortality rate, you should be aware that the most common causes for death in India, mortality deaths in India, are due to severe bleeding, mostly bleeding after childbirth, infections usually after childbirth, high blood pressure during pregnancy, and complications from delivery and unsafe abortions. So the aim of this program, the SUMAI program, is to provide assured, dignified, respectful, and quality healthcare at no cost, and zero tolerance for denial of services for any woman or newborn, and also to provide a positive birthing experience. To provide a positive birthing experience makes a lot of sense when it comes to Indian women. So I'm sure this particular program is able to achieve the aims of these these measures. And there's also this program called Lakshya, which is Labor Room Quality Improvement Initiative. It is aimed to improve the quality of care during delivery and immediate postpartum period. And to just brief you about the incidence of anemia in India. Iron deficiency is the most common cause of anemia in India, although other conditions like folate, vitamin B12, and vitamin A, etc., are the causes for anemia. But the most common cause for anemia in India, especially in women, is iron deficiency. So the government of India has initiated a program called Anemia Mukt Bharat, that is Mukt is eradicate anemia in India. So if you look at the incidence prevalence of anemia in India, according to a family health survey in 2019 to 21, 67% of children between the age of 6 and 59 years suffer from anemia. 59% of adults and girls between 15 and 19 years, 31% of adults and boys between 15 and 19 years, and 57% of women of reproductive age, and 52% of pregnant women. So that is the prevalence of anemia in India. So Anemia Mukta Bharat strategy is being implemented.
It's 15 hours.
All Indian villages through existing national Iron Plus initiative and weekly iron folic acid supplementation is provided for these group of patients. Now, target 2 is to end preventable deaths under 5 years of age. As I said, the UN seems to be very concerned about maternal deaths and deaths of children below the age of 5 and neonatal mortality. Now, the goals, SDG goals is 25 under the age of 5, there should be at least 25 or less deaths per 1,000 live births. India stands at 36 children, 36 deaths per 1,000 live births below the age of 5 years, and the SDG goal for neonatal mortality is less than 12, but India stands as 23. So the initiative taken by government of India to reduce the mortality rate is quite good. Before I discuss in brief about the government of India initiative, we should be aware of the causes for death among neonates and children below 5 years. The common causes of death include complications of preterm birth, deaths because of birth defects, sudden infant death syndromes, pregnancy complications, and neonatal encephalopathy. And very common is infections and symptoms, especially diarrhea-related infections leading to diarrhea and loss of life. So Government of India initiative has been life-saving services for labor and delivery by providing skilled attendant for every birth, referral to a health facility with basic or comprehensive essential care as needed for deliveries with complications, and the key postpartum service and key antenatal service. Of course, all these initiatives have been are quite effective, but in remote parts of the country, they may not be very effective, and a lot of deaths go unreported. The third target is to fight communicable diseases. As we all know, the communicable diseases, most common are tuberculosis, HIV, malaria, and a lot of neglected tropical diseases, hepatitis, waterborne communicable disease, and other communicable diseases. Now, notification of infection, cases of infectious disease is a critical step in controlling and preventing the spread of communicable diseases. India notified 2.5 million cases of tuberculosis in 2019, and about 177 cases of tuberculosis reported per 100,000 persons in the country. So what has the government of India done? It has revised, it had a program called the National TB Control Program. It has revised it, it's called Revised National TB Control Program. And it has released a national strategic plan for tuberculosis, which aims to end tuberculosis by the year 2025. And so that is quite a serious effort taken by the government of India. HIV incidence, the HIV main factors which have contributed to India's large HIV infected population are extensive labor migration and very low literacy levels in certain rural areas, resulting in lack of awareness and gender disparities. The government of India has also raised the concern about the role of IV drug use and prostitution in spreading HIV. To reduce the incidence, the National AIDS Control Organization, which is otherwise in short called NACO, has increased the number of centers providing free retroviral treatment, in short called ART, from 54 to 91 centers. All these centers have trained doctors, counselors, and laboratory technicians to help initiate patients on ART and provide follow-up care while protecting confidentiality. So that the effort seems to have given results. The HIV incidence per 1,000 uninfected population in India is estimated to have declined from 0.07 in 2017 to 0.05 in 2019. Coming to malaria, India contributes 77% of total malaria cases in Southeast Asia. And malaria in India occurs throughout the year across the country. However, it's most prevalent during and after the rainy season due to mosquito breeding. So various steps have been taken by the government to control the spread of malaria, like controlled insect breeding and individual preventions. The government encourages people to use mosquito nets or use aerosol spray spray during daytime, use biocides, etc., to prevent mosquito bites. Then prevention committee, this is done quite effectively and done by the municipal corporations in all the cities and towns and villages. By fogging during the outbreaks, they fog malathion during the outbreaks, and it seems to be quite effective. So that is how the country is dealing with mosquito menace in India. Now, fourth target is a reduction of mortality from non-communicable diseases. As you all know, non-communicable diseases are all the chronic diseases. And by 2030, reduced by 1/3 premature mortality from non-communicable disease. That's the aim of SDG 2030. In India, nearly 5.8 million people die from NCDs, and the most common causes are heart and lung disease, stroke, cancer, and diabetes. And the way India is trying to combat this menace to reduce deaths to NCD is to encourage a lot of physical activity among the public, encourage to have choose healthy diets, say no to tobacco, reduce harmful use of alcohol, trying to promote cleaner cities. And of course, those patients who suffer from NCDs and who cannot afford people who are under poverty, very poor patients who cannot afford, they get covered by the university. Mental health and suicide rates, according to the National Crime Records Bureau, the suicide rate in India per 100,000 in 2019 was 10.4. That's quite high. The fact that 71% of suicides in India are by persons below the age of 44 years. This imposes a huge social, emotional, and economic burden on our society. And the most common causes for suicide in India is either poisoning, hanging, or self-immolation. So priority areas to reduce the availability and access to pesticides, reduce alcohol availability and consumption, promote responsible media reporting of suicide and related issues, and promoting and supporting NGOs to improve the capacity of primary care workers and specialist mental health services. So that is about mental health and suicide rates in India. And as I said, this is the target 5, which is becoming quite a nuisance in our country. In India, opioids are commonly used by intravenous drug users. There are the most prevalent area in the country is in the northeastern zone, where heroin and dextropropoxyphene are the most commonly used opioids. Whereas in metropolitan cities like, as I said, I'm from Chennai, the capital of the country, New Delhi, Mumbai, and Kolkata, impure heroin and buprenorphine are the most commonly used opioids in these cities. So how do you prevent? All steps are taken by both the government and the NGOs to prevent drug abuse, and it is being achieved. In particular, children and youth they are provided accurate information about the risks of drug abuse. Schools are taking a lot of initiative to discourage their students from using drug abuse and teaching them about the ill effects of drugs and long-term addiction of these drugs. At workplace, employers can promote the health of employees by preventing substance abuse and assisting those with a drug dependence problem. And then raising awareness of driving on drugs is also a means by which we are trying to reduce the use of drugs. And mass media is playing a huge role in substance abuse prevention in India. The sixth target to reduce road injuries and deaths is again a huge problem in our country. India is one of the busiest countries in the world in terms of road traffic, with rapid increase in the number of cars and the mercilessly congested Indian roads. Road safety has turned into a factor of utmost importance for the country's citizens. So because of this very high incidence of road traffic accidents, for example, in 2019, about 150,000 deaths were reported. A lot of deaths go unreported, so which means that it is much more than what is reported. So the government of India has become very strict with use of helmets by two-wheeler users, and you wearing seat belts and child restraints. Setting and enforcing speed limits, they become very, very strict. We see that the strict programs by the government being enforced by the police department have reduced the number of road traffic accidents. And also unfortunately, thanks to COVID, the last 2.5 years, the incident road traffic accidents were quite less. And setting and enforcing alcohol limits is also very important. One of the main causes for road traffic accidents of late has been use of handheld mobile phones while driving and while riding bikes, and which is also banned, and very strict punishments and fines are applied on these users. And then every year in January, the whole country celebrates a week called the Road Safety Week, so that the people are aware of the ill effects of road traffic accident and the way to prevent it. Target 7 is to grant universal access to sexual and reproductive care, family planning, and education. India has done quite well with regard to granting universal access to sexual reproductive care and family planning. Institutional deliveries, according to the Health Management Information System, approximately 94.4% of total deliveries reported between April and December 2019 happened in the health institution. So that's good news for India. So, and in the year 2014, a new initiative was launched, which is called the Rashtriya Kishore Swasthya Karyakram, which is the National Adolescent Health Program, which prioritizes healthy development during adolescence. So these two programs seem to be quite effective, and and hopefully we should be able to ensure universal access to sexual and reproductive health care services, including family planning, information education, and integration of reproductive health into national state strategy and program by 2030. The 8th program is to achieve a universal health program. As I had already mentioned, To achieve a universal health program, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. So this provide access to affordable essential medicines and vaccination is in accordance with the Doha Declaration on the TRIPS Agreement and Public Health. India of late has been doing quite well when it comes to achieving universal health coverage. In India, out-of-pocket expenditure on health constitutes 13% of the monthly per capita consumption. Now, what is important is to make investments in health a priority in business operations. To facilitate investment, affordable medical and healthcare for low-income populations, leverage corporate resources, example, research and development, distribution, and cold chains, and to support healthcare delivery by public and international organizations. Now, India has recently launched this program called to achieve the vision of universal health coverage, the Ayushman Bharat. That's a flagship scheme of the Government of India, which was launched in 2017 by the National Health Policy. This initiative has been designed to meet the SDGs and its underlying commitment, which is to leave no one behind. Now, the Ayushman Bharat provides cashless cover of up to 500,000 Indian rupees to each eligible family per annum for listed secondary and tertiary care conditions. So these the patients can get any treatment done from including private hospitals, and which will be covered by the by Ayushman Bharat. Now the country is also planning to provide a card called the Ayushman Bharat card, which will be easy for which will be an easy way for them to go approach a hospital, show the card, and get any treatment done if it is within the allotted amount to each of the families. Now, I would also like to bring the importance of public-private partnership towards achieving universal health coverage. Public-private partnership of late has been touted as a solution for the ills of Indian healthcare system. But we are fortunate that in India, we have various private public partnerships, like there are umpteen number of medical NGOs which provide all these facilities to poor patients. Most of them get free treatment. There are clubs like the Rotary and Lions Club which conduct frequent programs, camps, and even provide treatment either free or at a very, very subsidized rate. And I would like to bring to your notice that India has close to 220 private medical colleges and close to 300 private dental colleges. These colleges, which also have their own hospitals, are playing a big role in the public-private partnership by providing free treatment to all the patients in and around the hospitals in the areas of this university. Okay, so target 9, the final target is illness and to reduce illness and death from hazardous chemicals and pollution. The single biggest reason for water pollution in India is urbanization at an uncontrollable rate. The growth, the economic growth has its own pitfalls, and one of them is the uncontrollable growth and of the urbanization, which has led to severe water pollution in India. Conventional sources of air pollution in India include vehicular emissions, coal-based power plants, fossil fuel consumption in industries, and some agricultural activities such as fertilizer application and farm fires. India has promised to reduce these forms of emissions and control pollution by I think in the next 50 years. And so since India contributes to almost 50% of global estimates of mortality and disability attributable to ambient particulate matter pollution, in 1 in 8 deaths in India are attributed to air pollution. So hopefully we should be able to overcome this huge problem. Now, before I finish, I would like to state that SDG 3 will not be achievable unless it is linked with 9 other SDGs, very, very important, like SDG 2. SDG 3, success of SDG 3 will also depend on end all forms of malnutrition, which is SDG 2.2. SDG 4.1 is free, equitable, and good quality secondary education, good quality early childhood development, knowledge and skills for sustainable development. And then SDG 5 is to eliminate all forms of violence against women and girls in public and private spheres, eliminate all harmful practices, include female genital mutilation, universal access to sexual and reproductive health and reproductive rights. SDG 6.1, access to drinking water, and 6.2, access to sanitation. SDG 7.1, access to modern energy services. As SDG 9 is 9.5, enhance scientific research, increase number of R&D workers, and 11 is 11.6, air quality and municipal waste, and 13 is 13.5, resilience to natural disasters, and SDG 16 is to reduce violence, 16 point, reduce violence and related death rates. So unless SDG 3 is linked with all the other SDGs, it will not be possible to achieve the SDG goals by 2030. Now, I would just like to show you this slide. As I said earlier, there are a lot of states in the country which are doing quite well, extremely well. The front runners being, as I said, some of the states in South India like Kerala, Tamil Nadu, from where I come. So these are the states, the first about 10 to 12 states are doing quite well. The other states are trying to perform and trying to come and become the front runners. But unfortunately, as of now, none of the states have become achievers. And hopefully by the year 2030, we should be able to reach that goal. Now, India and Sustainable Development Goals. So why India could make or break the success of SDGs. This is also, I am only mentioning these few points about India, but I'm sure there are a lot of other countries which need to play an active role so that we will be able to reach our goals by 2030. Why India could make or break the success of SDGs? Number one, is a huge country, the 7th largest country in the world. And as you all know, it has the second most largest population in the world, out of the 7.5. Actually, right now, it's close to 8 billion people. The Indian population itself is 1.4. And population living below poverty line is nearly a third of the world population is in India, which live below poverty line. Chronic malnutrition, child marriage is a very huge problem in the country. Open defecation, about 50% of the population is still adopting to open defecation. Maternal deaths, about 15%, and child deaths is about 20%. So India has to go forward and achieve these goals so that the whole world will be able to achieve the goals together. Now, quickly look at SDGs and dentistry. Oral health is not specifically mentioned and targeted in development agenda for SDG 3. I don't know, for some reason, dentistry and oral health has not been specifically mentioned. But as we all know, oral health is essential for general health and well-being. Oral diseases are the most prevalent non-communicable disease worldwide, estimated with consuming 1/5 of health expenditure. Oral diseases such as dental caries and periodontitis are preventable worldwide, and hopefully the FDI is trying to have a word with the UN, but as of now, it is not included in the SDG 3. Now, what is the message I would like to spread among the participants in particular, and to the whole population of the world in general? How will we explain this to the next generation if we do not do everything now, quickly and with determination, to preserve the basis of life on earth and instead just carry on as before? How do I want to explain this to the children and grandchildren if I don't change my way of living now, quickly and with determination for their benefit, and instead simply continue to live as before? So it's very important that we change now so that our children and grandchildren benefit out of these the goals of SDG. And finally, before I end, I would also like to add this point that the rich have a responsibility too. It is not only the third world, the underdeveloped or developing countries which have this huge responsibility. I think the rich countries also have a responsibility. Few people know about the 17 goals of SDG of Agenda 2030, about all the consumption behavior of the rich industrialized countries is the subject of criticism. The UN warned that without better performance by the G20 countries, which are responsible for 75% of global carbon dioxide emissions, the 2030 agenda will fail. If, as forecasted, the world's population increases from 7.1 billion to 9.7 or close to 10 billion in 2050, humans and the planet will face many challenges. Asia's rise will undoubtedly also lead to higher energy demand, more consumption and production. This calls for a public discussion on broad approach to sustainability and about overdue reform for economic modernization, climate protection, and innovation. This is, I've taken it from a source below. Finally, sustainability is still loading, and it's our responsibility to make sure that we achieve all these goals so that we are able to completely download sustainability. I end this presentation with a small slide. The one on the left is mindful, overconsumption. The slide on the right is mindful, which is needed as of now. Thank you, Professor Kano, once again for the opportunity and the kind gesture. I would also like to thank at this moment Dr. Mrinalini for all the efforts in bringing me here. Thank you very much.
Thank you very much, Professor K.K. Raja, for your wonderful and very informative presentation regarding SDGs. What we medical and dental healthcare providers can do for these, and especially your targets with the concrete number which your Indian society can have achieved already. But some targets you are now implementing for realize the goals, right?
Yes.
But how about the awareness of the need of SDGs in your society? Because our society, our country, of course, our globe have to be sustainable for the future, and so it's a very big and the worldwide SDGs target, but each individual, the citizens have to think about SDGs. Otherwise, the SDGs cannot be achievable. So, what about the tactic in your country?
Yeah. So
on SDGs.
Yeah. So that's a very interesting question. Now, before I tell you about what is the awareness of SDGs in my country, I would just like to bring to your notice that 2015, when the SDGs were developed by the UN, between 2015 and 2019, I have actually traveled across the world. I have been to the United States, I've been to Europe for various purposes, either for educational purpose or on holidays. But to tell you very frankly, I have never seen any evidence of SDGs even in these most developed countries. Like the way I saw in your country, I was so happy, I was touched. And I was wondering why you had actually asked me to give a lecture on SDGs, which is hardly heard of in my country. Now, as I told you yesterday, I learned about the MDG from my son, who had lectured on a program in New York. So as of now, SDGs, probably only the government organizations and offices are aware of SDGs, and they're trying to implement various programs to achieve these goals. But a common man doesn't even know what SDG is, doesn't even know what SDG is. For some reasons, I used to be in touch. I have a very close friend who is an Indian who's a consultant for the United Nations, who also the consultant for SDGs. I think SDG 4 or 5 for African countries. So I have been in on interaction with him, and I was aware, but I'm not as aware as the way I have explained today. So I think the only way for this to happen is, as I said towards my last few slides, is for everyone to take part. Everyone, the whole country, the whole world, at least the educated population has to understand and make sure that these goals are successful, like the way Japan is doing. Now I know why Japan is so advanced. Yes.
Thank you. Thank you very much. Yeah, as you just give us very important comments. Each individual has to be think about and aware the SDGs, and we don't need developed countries, developing countries. Yes. You know, the partnership, especially SDG goal number 17, the international collaboration, that can be the very important topic, right? For we are all healthcare providers in medicine dentistry, but even we can do the aim for any target, aim at any target. Actually.
True. Yes.
Thank you very much. So the time is very limited due to the time limitation. Now I would like to call on our Vice President from the Matsue campus, Professor Hiroki Otani is now joining. Could you please let me introduce our Vice President of Shimane University. Shimane University is now acting for more and more active the implementation for SDGs. Professor Otani, if you have a time,
yes.
Can you please give us some words?
Unfortunately, my video camera, very bad condition.
No problem.
So, but can you hear me?
Yes, I can hear very well.
Okay. Yes.
Professor Raja, thank you very much, very much.
Okay.
I'm so impressed with your wonderful lecture.
Thank you very much.
We learn a lot about the situation in your country.
Yes.
And whole targets and your strong effort to achieve each goal.
Yes.
Although you have still many problems, I anyway very much impressed with your strong effort.
Thank you. Thank you.
As you and Professor Kanno discussed right now, everybody should aware about the. Now.
Hello. Yes.
Hello. Thank you very much.
Thank you.
Thank you very much. We should know SDGs. As you noticed, there are many signs all through Japan. And because of television and SNS, many people in Japan become to know about SDGs. But I think the real implementation or wish to achieve SDGs is not at all deep, very superficial still.
Yes.
First step is to know about SDGs. That's true. But we need to deepen our understanding the necessary importance to change our mindset and change our lifestyle to achieve the SDG goals. Otherwise, I think it's very, very important, difficult to achieve the goals. And as you mentioned, I'm actually surprised, noticed but surprised that dentistry is not mentioned in SDGs.
Yes.
It's big mistake.
Yeah.
Dentistry, dental health, oral health
Health is not there.
very basic for human life, healthy life. Yeah, you should strongly mention that you should involve dentistry in the SDG goal. Yeah.
But we as maxillofacial surgeons, we are fortunate because cancer comes under the non-communicable disease and of course road traffic accidents and trauma. So to some extent, at least, we are included. What do you say, Hiro? In the SDG,
Yeah.
health and
Yeah.
wellness.
Yeah.
But unfortunately, dentistry they have avoided in the goals.
Okay, so thank you very much anyway for your wonderful presentation and also for attendance. I'm very grateful
Thank you.
for attending this wonderful session.
Thank
and
you.
Professor Kanno and Associate Professor Okui, thank you very much
Thank you.
for your active involvement of our university SDGs activities. Yeah,
Thank you very much. Thank you very much, Professor Otani. So he's the chair for SDGs in Shimano University, and we Shimano University are acting for SDGs, and of course the Faculty of Medicine is guided by our dean and director of the hospital, and we all are focused on the implementation of the SDGs. So due to the time limitation, the now already 6 minutes past.
One question.
Yeah. Okay, no problem.
I mean,
okay.
I'm so impressed by Shimane University and its efforts to be a part of SDGs and its success. Is there any way by which Shimane University and SRM University can collaborate with regard to SDGs? Because I think this is a small duty I can do for my country.
Exactly. That's a wonderful. Yeah. The idea that our university and the universities in India can collaborate each other, not only in SDGs, but also clinical research things.
Yeah.
Thank you very much.
Thank you.
Actually, I'm going to discuss with Professor Kanno after this seminar.
Okay.
Just as you suggested.
Okay.
Yeah.
Thank you. Thank you very much, Dr.
So let's collaborate.
Yes. Yes. Thank you very much.
Thank you very much, Professor Otani. So due to the time limitation, I have to close this session. Last but not least, the Dr. Okui is wrap up today's session for just within a short minute, couple of minutes.
Okay.
Dr. Okui, can you please wrap up and summarize today's session, and let's close the seminar.
Yeah. Prof. Raja, thank you for very much for your excellent presentation today. This is Tatsuo Okui. I would like to say a short wrap-up and closing remarks to this meeting. We have learned a great deal about the SDGs in India and the world. And also, we learned a lot from your lecture about some of the cutting-edge medical practice in India. India's population now exceeds 1.4 billion and is expected to surpass China to become the world's largest country in recent years. Therefore, the success of the global approach to the SDGs depends on India, I think. Today's lecture was specifically on SDG 3 and links with other SDGs. SDG 3 has a great many challenges to solve, such as mother mortality, preventable death of newborns and children under 5 years, road injury deaths, and many other diseases. Furthermore, India is known to be a high incidence country for oral cancer. This means that the role of oral surgeons on the SDGs 3 in healthcare is likely to be far greater than in other countries. I would like to conclude this lecture by wishing for future international friendship between Japan and India and for the sharing of the concepts of healthcare and SDGs. So, ladies and gentlemen, Prof. Raja's lecture will now come to a close. We hope that this lecture will be useful in your future practice and activities. Thank you.
Thank you. Thank you very much.
Thank you very much, Dr. Okui, and let's close this session. Thank you for
Yes, thank you.
joining
Thank you very
today's
much.
session from
ありがとう
India.
ござい
So
ました。
so many participants.
very much.
大谷先生、Thank you very much. どうもありがとうござい
あ
ました。
りがとうございました。
Thank you very much.
お疲れ様です。失礼いたします。
失礼し
失礼いたし
ます。
ます。